Hello, I'm Dr. Günther Demkova-Fuchs, Senior Partner with the Fox Group. HIPAA Risk Assessment and Compliance Infrastructure Related is our subject. We'll take 7 minutes to figure out what we need to know. An overview with selected critical details on the required components. Measured since 2003 until December 2010, resolutions by year and type have increased, as you can see. July 22, 2011, the federal list of major breaches measured since September 2009 included 292 cases affecting a total of 11.4 million individuals. This year there have been about 36 cases affecting a total of 3.1 million. And earlier this year, the Office of Civil Rights reported they had received notification of at least 31,000 smaller breaches, less than 500 individuals affected per breach. Why is HIPAA risk assessment required? What's the history? 2002 August. Original HIPAA privacy rule required policy and procedures, but not a formal risk assessment. February 2003. A formal risk assessment requirement for healthcare providers who create, receive, maintain or transmit EPHI was added. During 2009 and 2010, the High-Tech Act updates requirements including increasing penalties. August 2009 specifically, interim regulations requiring healthcare providers to notify individuals when their health information is breached. Depending on the volume of the breach, the notification requirements vary. July 2010. Meaningful use criteria relative to electronic health record systems now add risk assessment, HIPAA risk assessment as a requirement. February 2011. The business associate now required to comply just as covered entities are. 2011. The DHS awarded major contracts, 9.2 million to one company to launch audit later this year or early next year. The final regulations covering notification of breaches were withdrawn for further review. However, the interim regulations are still in effect, and providers are required to have policies and procedures consistent with the draft regulations to deal with them. What are objectives and goals of the HIPAA risk assessment? Reviewing current processes and procedures for receiving, handling, storing and safeguarding PHI and EPHI. Measuring and improving compliance with the HIPAA privacy rules and security rules. HIPAA privacy rules. Some examples of policies and procedures required. Dealing with privacy, confidentiality, notice of private practice, marketing, fundraising, sale of PHI, minimum necessary rule, research authorization, disclosure, employee training, observations of HIPAA compliance in front, back offices, administrative, clinical and by providers, and review of business associates, contracting activities and BA agreements in use. There are many more HIPAA security rules. Let me run by a few examples. Security management, worker sanction, responsibilities, workforce clearance, termination procedures, supervision, access to EPHI, isolation, health clearinghouse functions, login, password monitoring and management, security incidents, malware protection, awareness, training, reminders, vulnerability assessment. Reviewing access control, facility plans, security plans relative to maintenance repairs of facility, workstations, security policies and practices, and device and media controls such as disposable issues, reuse issues, and accountability. Finally, technical administrative policies, user ID, emergency access, automatic log-off encryption, audit controls, integrity, authentication, transmission security, and review of breach notification plan and procedures. Then there's contingency planning and contingency planning documents. Think about it this way. What do you do in emergency mode operations? How do you test and revise procedures relative to emergency modes? You need applications and data critical analysis. Data backup, data recovery, essential. In summary, key areas. A comprehensive HIPAA risk assessment must cover areas addressed by the privacy rule, areas covered by the security rule, and areas covered by the draft breach notification regulations. How can you measure the return on investment on a HIPAA risk assessment? If you're implementing an electronic health record system, classical measures include the cost of the assessment and/or corrective actions as compared to the incentive payments available for attaining and attesting to meaningful use, which does require HIPAA risk assessment. Or you can think in terms of the ROI for avoiding penalties and bad publicity associated with the breach of personal health information. If you'd like to learn more about HIPAA, risk assessment, and compliance infrastructure items, or the High-Tech Act, give us a call, drop us an email, or come visit us on the web. The Fox Group, providing excellence to the healthcare community since 1989.